when we're thinking about alternatives to criminalisation, we need to think about what the usual process is. So normally, if you're found in possession of a controlled drug, you would be arrested, charged and prosecuted for that offence. An alternative to that is the police can decide to divert you to an educative or therapeutic alternative which reduces the need for the costs and harms of prosecution. Criminalisation of drug possession is a deliberate infliction of harm. The idea is that if you punish people, they'll be deterred from possessing those drugs. Now, the evidence base for that idea is not strong. There's very little evidence that punishing people for drug possession deters drug use, but we know that it does harm people. It harms their job prospects, it harms their family relationships. So while criminalisation creates harms, alternatives to criminalisations can be used to reduce those harms. Traditional punishment in the criminal justice system has a very poor record in avoiding reoffending. We have very high rates of reoffending. But we do have encouraging evidence, including from 2 randomised trials in England, that diversion has better outcomes than traditional punishment in terms of reduced reoffending and reduced cost.
So Checkpoint is a deferred prosecution where we look at kind of diverting people away from custody or from the courts. It is a 4-month contract where we look at problem solving, diverting and reducing demand within the police service.
So the idea came around by trying to understand what our data was telling us in terms of those repeat offenders. We needed to do something different and try something different in order to make our service tenable to the public.
It was kind of born from the fact that, you know, if somebody does something silly as a one-off, why should they be impacted on for the rest of their life? If we see somebody within a couple of days, the engagement is better. It enforces that thing about that Durham Constabulary wanted to help them and support them rather than just putting them out, you know, with a charge or something. It's about, you know, encouraging them to see that, you know, we do care, we do want people to kind of move on. The cops aren't chasing that person again for the next 4 months, so it's a win-win for everybody.
So a Checkpoint Navigator, we are specialist workers who work with offenders 72 hours after arrest, and we'll provide an in-depth needs assessment, then provide them with a bespoke contract for the 4 month. Then we'll work with them over the 4 month to look at, you know, the criminogenic needs. We'll look at everything which can lead to offending. So we'll look at housing, mental health, finance, drugs, alcohol, and we'll really spend time with people. And we won't have like a police environment. We'll do it in our office, which is, you know, a bit more friendly facing. And then from there, working with them to decide what contract conditions they would like to work towards. So the contract, it'll always have some of the same sort of conditions. So the first one will be not to reoffend over the period of the 4 months or participate in behaviour which may render you liable to arrest. You know, number 2 would be that you engage in consequential thinking with your navigator, you attend all appointments. And then from there, it could be whatever comes up in the needs assessment. So it could be that you're willing to be referred into drug treatment, you're willing to work with social services and stop the reoffending.
Hello, my name's Paul, I work for User Voice. I've got lived experience. I've literally gone from smoking crack to cracking crime with Checkpoint and rehabilitating the streets.
So User Voice is a charity, UK charity, and it's led by people who have lived experience of the justice system. About 85% of people we employ have a criminal record.
I think the value of lived experience is that people know, you've walked in their shoes. As soon as you mention that we've been in prison, I've got lived experiences, it's known now. People tend to engage with you a lot better.
Qualitatively, we have 221 people who've been interviewed or involved in focus groups to find out about their experiences of diversion. We've also developed a quantitative data set of nearly 45,000 people who've been caught by the police for drugs and related offences. And we're using data on their offending and on their entry into drug treatment to evaluate the effects of doing diversion. And we're using those results also in an economic evaluation, which will also feed into what's known as a realist synthesis that helps us understand the context, mechanisms and outcomes of police-led drug diversion.
You know, Checkpoint and the data is evidence-based, so any work that we do with the academics is always really appreciative to sell our message as well and keep the legacy of Checkpoint going.
I don't think there are any alternative services that provide an holistic approach like Checkpoint do. I think, you know, if you have housing services, drug services, they're focused on those, whereas I think Checkpoint is the only service that I can think of what's looking at everything. And I feel that to have behaviour change and to change people's lives, you need to be looking at everything, because everything interlinks, you know, all the complex traumas, they're all overlapping.
When you look at criminalising somebody, it's not just the impact on the person, but it could be the impact on the families. You know, if somebody's impacted by drugs, there's obviously some sort of financial impact, relationship impact, housing impact, and again, that's kind of, you know, what we're trying to do there is work with the adults to prevent, you know, adverse childhood experiences, and I think that's another big impact where we can work with the whole family, making sure that we can kind of do the best for everybody.
Diversion schemes have a wide range of people who are diverted to them, from 18-year-olds who are caught with a small amount of cannabis to 45-year-olds who've had long experience with problematic use of heroin, for example. And at the moment, the research that's coming out from our work suggests that you need different approaches for different types of person. So that 18-year-old who's caught with some cannabis might just need some information about the harms of cannabis that helps them decide what they want to do in the future. Whereas that 45-year-old who's got a long-term problem with heroin probably has quite a lot of other problems in their lives, and a more individualised, tailored, long-term package of support may be more appropriate to them.
We're changing lives, we're getting people into, you know, recovery, whether that be drug recovery, we're getting families reunited who have, you know, been struggling with finances and mental health.
There was one lady, for example, who told me that she was on crack cocaine when she was arrested. She lost custody of her children, but over the course of the 4 months, Checkpoint actually helped her rehabilitate in herself, and after the 4 months, she had her children back.
On arrest and things, they may be kind of, you know, reminded that they're drug addicts or reminded that they're, you know, worthless and things like that. And she actually said, we don't need reminding of that because we actually know that ourselves. What we need is somebody to show a little bit of compassion, stepping in at that time when they're at an absolute low, and having the right person to see them can make a massive difference in people's journeys.
Our research shows that individuals who are diverted can benefit from that diversion, but it also shows there are wider benefits to police forces and the community. For police forces, it reduces the costs and time they have to spend on dealing with drug offences and related offences. For communities, if it reduces offending, that is reducing the crime rate. And it's also that the people who are committing these offences are part of communities, and doing less harm to them reduces harm that is done to the community. Some people are sceptical about replacing prosecution with diversion, and they would rather see the traditional approach of arresting and punishing people. What I would say to those people is, please look at the evidence. We have been doing that for decades, and the evidence suggests that it is not effective in reducing levels of drug use, and it's certainly not effective at improving the lives of people who've got problems with drugs or their neighbours and communities.
We can't just keep building prisons to hope that that solves the problem. We've got to have an earlier intervention at a meaningful point in time that actually has the opportunity to change somebody's lives, and it's those success stories that will allow the public to understand the benefits that early intervention and diversion can bring.
Checkpoint's probably perceived by the public as the easy option, you know, getting everybody off with criminal convictions, but unfortunately, you know, in the world of courts and prisons, we all know that they're overcrowded. But I do think that if they saw the wider picture and understood more about it, then they wouldn't say that. The evidence suggests that it drives down demand, it reduces reoffending, and also kind of a year post, we're still at like really high figures of reducing reoffending rates. The amount of people that fail the contracts is sitting at around 13%. So again, when police officers are kind of worried that they're going to get a load of work back from us, 13% is nothing compared to the 87% of those people that you're not going to chase for at least 16 months afterwards in most cases.
Checkpoint is not the easy way out. If anything, it's the opposite. You know, we're banging on the door every week for 4 months. It's the total opposite. You know, any other alternative prosecution, it's going to lead to the same thing happening because you're not addressing the root cause.
Try to understand why people are taking these drugs. There's always some reason that people don't set out to be a heroin addict or a crack cocaine user. There's other things going on in the background. So once the police and the government start to understand why people are taking drugs and offering help, and I think that Durham Constabulary, I'd give them a pat on the back, so to speak, and I think they've done really well, and I think it's very forward thinking.
One of the reasons we started doing this research because we wanted to inform policy making, spending on policing and the way that policing is done. And the emerging findings from the PDD research project suggest that diversion is going to be an effective way of reducing the harms of criminalisation and helping people to deal with any problems they have around their drug use. That means that the government will be able to save money because it is cheaper, we think, to divert than to prosecute. It also means that for people who've got problems with drugs, there may be new routes into treatment that can help them. And in the long term, that should also reduce crime.
I think if I had any words of encouragement for officers to use diversion, it would be just kind of look at the wider picture, look at what's happening with somebody, try and consider like if there's a little bit of a story around them. We need to be looking outside the box. We need to be thinking about what's going on within this person's life, asking the questions, which is something that people say to us all the time. Nobody's ever asked me that question before, so they've never found out the answer, and that kind of unfolds a lot of problems, traumas that they've had to go through for a lot of years, like thinking about next week rather than having to chase that shoplifter again next week. Let's see if we can, try and stop it today.
I was actually at this police station for my offence. I mean, everything's changed in my life now. I live up here, I've got a career with Use Your Voice, which I really enjoy. And coming back here now, it's ironic, but I feel comfortable being here and I feel like a changed man. And like I said, I'm glad that Checkpoint is helping other people as well.
On the PDD research project, we've been working with a large number of partners, including the College of Policing, including several other universities, including the Department of Health and Social Care, and also, very importantly, Use Your Voice. It's only through bringing together all these perspectives that we've been able to create such useful knowledge on police-led drug diversion.